Healthcare services could soon be disrupted if health workers make good their threat. This comes after the Health Union Caucus on Monday threatened to stage demonstrations this Thursday, citing what they describe as the government's prolonged neglect of universal health coverage and Global Fund health workers. The story was produced by Moluse Mishek.
Healthcare services across the country could be severely disrupted following the announcement of planned demonstrations by health workers this Thursday. The Health Union Caucus, speaking in Nairobi on Monday, expressed frustration over what it termed as the government's failure to adequately address concerns affecting UHC and Global Fund employees.
From Thursday this week, we will begin demonstration at Parliament House. We will go to Afia House, to National Treasury, and we will be asking them to amend or review the budget.
Union leaders argue that the government has shown little commitment to offering permanent and pensionable employment to UHC workers. They're demanding that the process of confirming these workers into permanent positions be expedited before their current contracts expire. According to the union, employees working under the Global Fund program have gone for several months without receiving their salaries. They're calling on the government to urgently address the matter and ensure that funds are allocated in the budget to settle the outstanding payments.
The National Assembly and the Senate must sit and reconsider and allocate this money through the Division of Revenue Act.
Cabinet Secretary for Health need to answer us. How long does it take to resolve a matter of 112 workers?
In the budget recently presented by Treasury Cabinet Secretary John Bade, the Global Fund was allocated 18.5 billion Kenyan shillings to support efforts in combating HIV/AIDS, tuberculosis and malaria. Meanwhile, the Universal Health Coverage UHC program received an allocation of 19.1 billion Kenyan shillings to support healthcare services in dispensaries, primary healthcare facilities and community-based universal health services across the country.
Immediate absorption of all the UHC and Global Fund staff into permanent and pensionable terms and issuance of appointment letters by 30th of June 2026.
The union has warned that if its demands are not addressed, healthcare services across the country could be significantly affected, as workers have vowed to take to the streets to pressure the government into action. All eyes are now on the national government as Kenyans wait to see whether these demands will be met and whether a looming healthcare crisis can be averted.
Safina Party leader